Hi, I'm Toby Kohler. I'm a urologist here at SIU School of Medicine. I'm an associate professor in the Division of Urology. I love to teach because I'm not that bright a guy myself, and so I like to surround myself with many smart people. That way, if I have questions I can't answer, they can answer them for me. When you teach somebody how to do a surgery, you are able to help that much more than any one individual can do. If I'm lucky in my career, I will do maybe, 1,000 surgeries. You know, we have 2 residents that we take here every year, and every resident, I teach them how to operate, and probably more importantly, when to not operate, to have good surgical judgment as to when to do nothing. If you figure I'm around for 20, 30 years, I can operate maybe max on 2,000 patients, but I'll have taught 40 residents, hopefully, to operate well and do the right thing. And so what's the math on that? 80,000 patients. And now if they start to teach their students the same thing, all of a sudden my influence is cast everywhere. It's very selfish, but at the end of the day, I want to feel like I've made a difference. There's nothing quite like having somebody master something or really understand the subject matter. I mean, I feel my role is that when somebody is done with our residency program, they should be a better surgeon than me. If I'm not producing people that have more skills than I am, I think I've failed in a sense. The most exciting thing for me is to come here and teach medical students and residents. That I really couldn't be happy, I don't think, without that as part of my practice. SIU Urology's residency program is dedicated to teaching. That is why I came here. I had the opportunity to go many kind of more famous name places. No place expressed a sense of community or a sense of, an emphasis on teaching greater than this institution. I remember when I spoke to the chairman at the time for the first time on the phone, he said, if you're not interested in teaching, don't bother coming here. And that's pretty bold for somebody to say on the first conversation to fill a position where there's not that many of us to go around. But that very much impressed me, and that's a tradition that we've continued to do here. And if you love to teach, you'll thrive. If you don't love to teach, you won't do well at SIU. I keep in touch with former medical students who I influenced that actually went into urology because when I was a resident, they saw how much fun I was having, and so they went into urology, so I keep in touch with them. But clearly, I mean, especially when you're younger and you're starting out, and still I feel very close to all our residents. I spend time with them away from work. Sometimes we go water skiing on Dr. Schwartz's boat, that kind of thing. I speak with residents often. They call me sometimes for advice. It's always nice to feel like they need me still, but absolutely, that makes it the most rewarding thing. And nothing makes me prouder to graduate 2 residents that I feel are the top in the country, that are great surgeons, but have great surgical judgment as well, and will take great care of patients.